Dying of a broken heart is a real condition and not just empty words. The emotional impact of a broken heart can have real and serious medical consequences. The connection is due to the stress that is felt when we are sad and eventually lose our lives. Stress can trigger a typical heart attack and people die from it, says Dr. Harmony Reynolds, director of the Sarah Ross Soter Center for Women's Cardiovascular Research at NYU Langone. A common example of dying from a broken heart is someone who dies shortly after losing a partner. Some of it is heart disease. I don't think we fully understand why that is. That's just one piece of evidence that stress is a trigger for cardiovascular disease. Dying of a broken heart can be classified as Takotsubo syndrome, which is a temporary heart condition often caused by a stressful mental or physical event such as the death of a loved one. Often referred to as broken heart syndrome, this condition accounts for about 1% of all acute coronary syndromes and is often indistinguishable from a simple heart attack. This makes people who suffer from this disease actually have to get medical intervention immediately. Sudden cardiac muscle weakness is most likely due to an imbalance of the autonomic nervous system. The cause may be physical or emotional stress, in 1/3 of cases with an unidentifiable cause of stress. On the other hand, the symptoms of Takotsubo syndrome don't only appear when someone has a broken heart. As I often see in my clinical practice, it doesn't happen right away, it might happen days or weeks later. One of the phenomena of stress is that we meditate on it, and sometimes those thoughts are not even realized. This condition is also sometimes triggered by happy stress, namely positive life events such as the celebration of the birth of a grandchild. In Takotsubo syndrome, 90% of patients affected are postmenopausal women, many of whom were previously diagnosed with a mood disorder or brain disease, including stroke. So far, the best treatment for broken heart syndrome is unknown. Use of prescription ACE inhibitors can have a positive impact on recovery. Exercises such as yoga and meditation, which are known to increase parasympathetic function, relaxation, with deep breathing may also help. Broken heart syndrome usually heals completely, but its similar symptoms to a heart attack make it hard to tell the difference. Takotsubo syndrome may not appear as pain in the chest. It can be anywhere between the jawline and teeth to the upper abdomen. This may also include shortness of breath, nausea, vomiting, sweating, or the feeling that something is wrong. That's the video this time. If you think this video is useful, please give a thumbs up, subscribe and share with your friends so we can continue to provide interesting content. Thank you for watching.